Hi, glad to have you back and glad to know that you're still tuned to Hello Africa on Clearview Television. So, we have a guest in the house today. He's Dr. Roland Aibovo. He's here to buttress on the issues. Of course, Dr. Roland is president of Resident Doctors here, the association, of course, the association in Abuja, that's the Fcta. There are a lot of issues. Last week, was it? You had a press conference.
Yeah.
Yeah, to drive home your worries or your challenges and all. And you've given an ultimatum.
Yeah.
Can you shed more light on the rationale behind the press conference? What these demands are and all?
Okay. Thank you very much. Actually, I had a press conference on the 3rd of June, which was actually after the second quarter ordinary general meeting, which held on the 31st of May 2019. Well, what gave rise to the press conference was the ultimatum, that was 21-day ultimatum that was issued to Federal Capital Administration management on some unresolved issues, which boils down to stagnation of doctors. Okay, now AR Association of Resident Doctors (FCTA), they are a body of doctors who are working in the 14 general and district hospitals of the Federal Capital Territory Administration, including the Department of Public Health and the FCT Primary Healthcare Development Board. Before now, following the implementation of the skipping policy in FCT, our members who were due for promotion have been stagnated.
Sorry, I'm going to pause you. What do you mean by skipping policy? Because a lot of people that will be listening to you, they wouldn't be able to relate to.
Okay, all right. Yes, skipping maybe has become a household name now in the health industry. It's actually a correction of an error in the grade levels of healthcare workers that was done during the conversion from there have been conversion from HATIS salary structure to CONTIS salary structure, from CONTIS to that now gave birth to COMERCE and CONHEALTH. COMERCE is a consolidated medical salary structure, and CONHEALTH is the consolidated health salary structure. So the COMERCE is for doctors, while CONHEALTH is for other health workers. So during the conversion, a grade level was actually there was normally grade level. There is no grade level 11 in the public service. So from 10 you move to 12. So, but during the conversion for the CONTIS, from HATIS to CONTIS, a particular grade level was supposed to be skipped for health workers, but no, that was not done. Everybody was to proceed along that line. So when the error was detected, how big, the issue was brought up after a series of negotiations. There was no headway. They now have to go to industrial court, where the industrial court make a pronouncement that yes, that particular grade level should be, which is grade level 10 for those in the CONHEALTH 10, those in the CONHEALTH structure, and COMERCE 2 for the medical doctors. So that was what gave birth to the word skipping. So we are actually moving past that grade level. So when that was implemented in FCT, our members who were due for promotion, their promotion were delayed. Before the promotion was finally effected, they were moved to the next grade level, which is the correction of the error that had been there. Now, when the promotion now finally came, they were now promoted to that same grade level they were moved to, which was supposed to be the corrected grade level. So they moved to that same grade level. So that means now more like a nominal promotion, that promotion without advancement. So we've had a series of meetings and discussions with the FCTA management. So we actually met with the immediate past FCT minister twice last year on this issue, where he gave they gave a directive that it should be corrected. And on several occasions we met with the permanent secretary and the director of human resources, who, though verbally, said once the 2017 promotion exercise is completed, the 2016 will be corrected. But to our greatest dismay, the 2017 promotion exercise was the successful list was still to the same grade level. We felt that, you've reneged on your own promises. How long can we continue to do this? And we've been on this issue since 2016. Since 2016. So that is one of it. Then the other one is the issue of, as medical personnel or doctors, there's what we call postgraduate training which is residency training, where medical doctor undergoes another 5, 6, 7 years of postgraduate training to become a specialist. Some of our members have released to go do that training, and now they come back, they are already specialists, but they are still working as medical officers.
And not specialists.
No, sorry, they are working as specialists, but paid as medical officers. You understand? Because as a specialist or the consultant, you are the head of the team. If you are a medical officer, it's a different thing. But now you are taking charge of the team, working as a consultant. They are being paid as a medical officer for as long as 3, 4 years. We say this is not right. Then thirdly, the issue of well, like we all know, the public service rules of the first 28 days allowance for federal employees, what we call more like relocation allowance. So many of our members who were employed over time, they were never paid that first 28 days allowance. So when we met with the immediate past minister, sorry, I will not keep referring to the immediate past minister because this issue is being a little bit chronic, if I may use that word. When we met with him, he actually approved the payment of that money.
The approval, was it a verbal approval?
No, there was an approver. It was written approval. Yeah, there was an approver. So that led to the payment of a selected few of us.
Why?
Now, that's not the question.
What was the criteria of selecting those few?
Well, the association never knew about the criteria they used. We only stumbled into the document and we saw some names that were already listed for payment. You understand? So the last batch that were paid was 2011. So between 2012 and 20 till date, none have been paid. They only now paid from 2016 to date, leaving the last chunk of those that were employed between 2012 and 2015. And we also wrote to them, and we all hear all kind of stories and everything. Like, okay, no, there's no money, or there's already an approval. You can't keep dragging these issues for too long. Then that's actually the key issue.
So
then
please,
the
I'm
major,
going to cut you there. Like, how many years precisely has this been ongoing?
I would say 3 years, because the skipping implementation was done in started November 2016. And those that were affected in 2016 promotion are there. The 2017 that have just been approved is there. And now they are doing screening for those that are due for 2018 promotion exercise. And they were still screened to the same level they already. And they are saying it's salary adjustment. I have not actually had the opportunity to have a discussion with them on that part. Because if you are telling me it's salary adjustment, that is not promotion. Yes, it's not promotion. But if you say a grade level have been corrected, it should mean that is my new grade level. So whatever happens, I need to take up from there forward, not keeping me in a particular grade level for going to like 4, 5, 6 years.
So during the course of your conversation, you made mention of how you've said approval from Fcta minister, approval from Fcta minister. It meant that there has been negotiation or conversations that you guys have had, the association had over the years. Yeah. It's 3 years.
Yes.
3 years, like you said now.
Yeah.
Yes. So if this problem has lingered for 3 years and it has not been solved, the ultimatum you're giving now for the strike action, do you feel it's going to bring a lasting solution to this problem?
I was even going to go to that.
No, but sorry, let me answer this way. This issue has been lingering. Actually, a 21-day ultimatum was issued to Fcta management last year, August. So that actually led to we meeting the minister then, after we issued the 21-day ultimatum, of which some of the issues were addressed, and that's what led to the payment of the first 28 days for some. Then the payment of some part of the skipping areas were also paid. You understand? So because of the goodwill of the minister, or the gracious approval of the minister for some of those issues, we decided to, in short, we extended the ultimatum up to February 8th this year, where the extended ultimatum was vacated. And also taking them, of course, their management, whether it was put in right, or maybe the mistake we made was that we would have gotten a written commitment from them. We believe their words as, okay, you have shown some level of commitment to resolving this issue. You've told us what you want to do. No problem. We'll take you by your word. We vacated the extended ultimatum. pending the fact that if 2017 promotion exercise is out, is approved, then if you now correct the anomaly, everything will go well.
Yeah.
But if you don't correct the anomaly, then it's as if you've drawn a battle line.
So now the
So
battle
Now
line
the
has
battle
been
line has been drawn.
talking about the battle line
Yeah.
now, you've got my heart skipping. What is the likely resolution of doctors?
Well, there's one thing I believe: freedom is never given for free. You need to fight for it. It has been a 3 years of all talk, no movement, or no action. Whatever it takes, we are ready to throw that part. And sincerely, let me also tell you that we didn't just give an ultimatum and decide to go and sit down. We're actually also conscientizing our members, moving from hospital to hospital, to tell them that, because definitely not everybody will be able to attend the meetings. But we want to tell each and every of our members that these are the issues on ground. This is not an issue of, okay, no, maybe I'm not due for promotion here, because whatever is happening now, 2016, those in 2016 are affected, 2017 is affected, 2018 is affected, 2019, 2020, depending on how far this issue lingers. So we are moving from hospital to hospital, facility to facility, to sensitize our members, that this is what we have to do. And as long as it takes, we are going to toe that line. As I speak, today is 14. 11 days into the issuance of ultimatum. Management have not shown anything. They've not reached out to us for discussion and everything. So if, even though I believe that health is not a priority to our leaders across board, I don't mind words in saying that. I've said it on several occasions. Health is not their priority. If health is their priority, I don't think all these things would have been happening.
This actually moves me to my next question, sir.
Yeah.
You'd understand that the health sector that you doctors are mining, it's a very pivotal role in Nigeria, in the sense that if you embark on strike, it's the commoners that suffer the most.
Strike. So I was even going to
No, the ultimatum is for them to drop their
no, I
tools.
want him to say it.
No, I won't say we are going on strike here and now. We only give an ultimatum. Maybe leaving this studio, they might call me, okay, let's talk. But one thing I believe for sure is that before the expiration of that ultimatum, all these issues have to be addressed.
Else,
we'll take it off from there.
You take, okay, then
if it doesn't, you are calling for emergency general meeting. The emergency yeah, definitely. At the expiration of the ultimatum, we'll call for an emergency general meeting where the decisions will be taken. My members might be kind to say that, okay, let's extend it and give them more room. If they've shown any sign of discussion, let's resolve this issue. Okay, they've not shown any sign, they are willing to toe the hard line, we'll go with them.
Sir, we're looking at people that have not been attended down 2011, because you made mention of some people in 2011, 2012 and all that. It means it's quite a long process.
Yeah. And so their issues are still on ground.
Yeah. No, the issue of 2012, that is the payment of the first 28 days allowance.
Yes.
Okay.
You understand? That is about, for the promotion and stagnation, is from those that were promoted 2016, 2017 now. And they just finished, the screening is still ongoing for those that are due for 2018 promotion, and they're still promoted to the same grade level. And they're telling me salary adjustment. I don't understand what they mean by salary adjustment, because if you say I'm in grade level 13 and you're paying me salary of grade level 14, you need to justify why you're giving me a salary of grade level 14.
Okay.
Yeah, that's the truth.
That's something. I'm going to move away a bit from this main matter. Okay. So there are scenarios whereby you go to a health facility and the health workers' attitude towards work, it's quite baffling. We know that as health practitioners, health practitioners, right? Yes,
generally.
As health practitioners, you're saddled with a responsibility. You've sworn an oath and all. These demands you're making, they are not far-fetched, but
if these demands are met, which I know they will definitely be met, what happens in the health facilities?
Okay, well, I won't say we are all saints.
Yeah.
We have our own issues. But one thing you should also understand is that there are a lot of factors that drives individuals to do whatever thing a divider does.
So these your demands are actually inclusive.
Yeah, of course, they are. Because, okay, let's see, look at this scenario. Somebody was employed in 2016, somebody employed in 2014. The person that was employed first had not been paid, 2016 had been paid. That's demoralizing. I don't know the rationale they used in doing that. Like I said, the association never knew until we stumbled into the document to see that these are the lists. That aside, I also raised this issue during the press conference, the issue of personnel. It's no longer news in Nigeria that we are faced with a lot of challenges in the health system, especially with doctors.
Exactly.
The brain drain. Doctors are leaving this country in droves. No, I will tell you, the last time FCTA as an institution made a formal employment or recruitment was in 2011.
That's a very long time.
2012 is what they call replacements and all this. It wasn't a full employment per se, or just okay, we have these vacancies. Since we've not been able to do a full employment, let's fill up these vacancies. They have been filling up vacancies up till as we speak. You understand? And people are leaving every day, either by brain drain or by residency training, because not all departments are offering residency training in FCT at the moment. So those are not offering, doctors are moving out. Now, also retirement, either by age or voluntary, even death. So in the last 4 months, last 5 months, in the beginning of this year, we lost like two or three doctors in the FCTA. Now, if these doctors are leaving or the health workers are leaving, there is no replacement. And the population of Abuja, like we all know, is on the increase. One of these days, if I can take, maybe investigative journalist investigation to do and go to these hospitals.
I've actually roved to some of these primary.
You understand? You see the amount of patients that are seated, waiting to be seen by doctors.
Spend all day.
And doctors are few. Of course, we have an obligation to give the best to our patients. But we are also human. A situation whereby, as a doctor, you are seeing close to 40, 50 patients in a day. Well, believe you me, maybe the first 20 or 30 might get the best of care. The others are just like, okay, let me just at least attend to them.
Because the doctor would have been exhausted.
Exhausted. We are all humans. You understand? So that is one of the major problems we are also facing in FCT. And now they've brought in a new trend of casualization of doctors in the name of locum. Rather than employ doctors in full employment, they are bringing doctors as on contracts and calling them locum, paying them peanuts. Maybe perhaps those doctors are maybe stranded, or for one reason or the other they have to take up their employment. But you can't expect a doctor that is employed as a locum or contract to be motivated to work just like a full staff. Even the full staff is not even motivated. Not the talk of the contract staff. Yeah.
So you just made mention of something that actually got me thinking. The previous minister, Chris Ngige, made mention of how Nigeria has surplus doctors. It's not a big deal for the brain drain and all. Yes. So I would really want you, as the president of an association of resident doctors in the FCTA,
yes, please shed
more light on this.
Well, with all due respect to a very senior colleague, I don't think that was a statement that was appropriate. Apart from the fact that he's a medical doctor, he was then the Minister of Labour. And if, as a Minister of Labour and a doctor, coming on air to say that we have a lot of doctors that you can export, for me is a misnomer. Now, in the MDCN register, we have barely about 80,000 doctors registered with the Medical and Dental Council of Nigeria. And of these 80,000 plus, less than 40 are practicing in Nigeria. Now, if we take 40,000, divide estimated 190 million with 40,000, you can see the average of one doctor to one patient, which the WA standard is supposed to be one doctor to 400 to 600 patients. They start having one doctor to over 6,000 patients. And now you are still saying that we have a lot of doctors to export. For me, well, I really don't want to dwell too much on that line because it is obvious. You understand? It is obvious that he just went on air, maybe unprepared, if I may say, or maybe to protect his office, because of course when you are, irrespective of who you are, once you get such appointments, you want to do everything to protect your position. But then I think there would have been a much more better way to have meander his way out of that question rather than roping himself into that controversy.
And
So,
then,
And for the records, it's not true.
and my question now is, I know you would have, you will say you, I could see it obvious from what you had said, but
Yeah.
then I want you to say it here on air. Why do doctors leave the country?
Well, I I don't mind voice when I say this anyway. Doctors leave the country on several reasons. One, for greener pasture, for better remuneration. One. Two, a certain number for training. But above all, the most important reason is because of the remuneration. Now, as a maybe a fresh graduate doctor in either in the US or just developed countries, you earn almost what a consultant, or even more what a consultant earn in Nigeria
as a medical
As a medical
as
doctor?
a medical doctor. A fresh graduate earns even more, almost the same amount or even more of what a consultant earns in Nigeria. And apart from that, look at the working conditions. Sometimes we come to the hospital 8 a.m., work till 4 p.m. That 4 p.m. is relative. You understand? Now you are on call, which means your duty starts from 4 p.m. to 8 a.m. the next day. And by 8 a.m., you are expected to carry on with the next day's work. There is no time for rest. And if we are to quantify the issue of working, let them pay per hour, maybe, just maybe, that might bring back some people who are leaving.
Alright, we're still having a conversation with Dr. Roland, the President's Association of Resident Doctors, FCTA. We're going to short break, and when we return, we're going to wrap up this conversation. Don't go away.
Value plan. I used to get one plan for my calls and then try to remember which data plan worked for me. Roaming was a totally different ballgame. Not anymore. I've got the MTN Extra Value all-in-one plan. If you're a data buff like me, you get extra data with some talk time. And if you like to make calls, you get extra talk time with some data. And when I'm abroad, I automatically browse, chat, and call right on the same plan. MTN Extra Value was made just for me.
More of data or calls, whichever one you prefer. MTN Extra Value is made just for you.
Uni ahoime banguni enwome ati sojete banguni iresu amuhi baki epezwe ati ameme worokame da shekura novede ibira babeva says onini isamuhi oneli odobide kura ame oneli saza esikameni avabani voneva savore diaka iresu ibira babe TV oneva save of down in jozile sokoko eturonone ibira babe yafabe inyo ishehun dia novede.
Látòrí ìdárayá sí orí ọ̀dọ́, látòrí ọ̀dọ́ olóṣèlú títí dé orí àwọn lọ́balọ́ba àti ìjòyè ya wọn. Ẹ̀kọ́ àti àṣà àti ìṣẹ̀yà. Ètò ẹ̀jáyé ìgbọ́ra ó ti rá láti jẹ́ àmọ́ ọ̀pọ̀lọpọ̀ ní ìṣẹ̀lẹ̀. Ní agbègbè ra àti àyíkára nílẹ̀ ọkùn. Agbọ́ra, àwòrán níbi ẹ̀tíyàwó ra ẹ̀. Ètò ẹ̀jáyé ìgbọ́ra àti mọ́rin gbogbo níbẹ̀ ṣẹlẹ̀ àwòrán lórí rẹ̀. Ẹja sọmọkọ ọmọ sọmọ.
Wow! Ekide ṣe wà gẹ̀gẹ̀dẹ̀dẹ̀ jẹ́ kó máa gbómú wẹ. Ekide ṣe todu káleke bí kọ́lọ́yọ́gbá. Ká àwọn dúgbẹ́dẹ̀ mú àwọn ọmọ àgbàdùfò ọ̀nẹ́kẹ̀lẹ́ ponúgulẹ̀. Mánike tọ́mà alùpùpù gbà báyìí alùpùpù kọ ìchíwà ìgalà. Omikùnà kà ìṣọ́mánẹ kùkójanẹ ìgalàdẹ̀. Ẹ̀dọ̀mí ṣẹ̀bọ́kù gbójílé ìṣọ́mánẹ ìgalà. Lákínà gòwá ojí tẹlifíṣàn kìdẹ́ lọ́ba. Ẹ̀kídẹ́rẹ́ máa bínú.
Glad to have you back. We're still having the conversation in which the resident doctors in the Federal Capital Territory, of course, it's an umbrella body of health workers. They're driving home their points. Truth is, our level of commitment towards making Nigeria a better place and keeping a healthy society, if you have that consciousness, you would actually be able to relate to what they're driving home. They're not asking for too much, as far as I'm concerned.
So
but then,
the federal government should try to play their role. You know, I believe Nigerians are making this call that the federal government should try. There should be a dialogue. You know, and the proper and right things should be done.
I
So
was
that
going to ask Dr. Roland, sir, have you treated any serious government official in your hospital?
Well, not really. Not really. Even the directors in FCTA, as small as FCTA, don't even patronize
is it that
the
they
whole
don't fall?
FCTA hospital. Of course they do. We are all humans. You understand? Because they don't patronize the facility. They don't even see any reason why they should even invest in the facility. You understand? But they forgot so soon that in as much as they don't patronize it, they are just one out of many. It's not everybody that have the luxury of, once you have headache, the next thing you already have your visa, your passport, the next thing you just jet out of the country. How many people have that luxury? Let me even digress a little bit. That even the president is saying that he wants to take Nigeria out of poverty line. Of course, he recognizes the fact that a large chunk of Nigeria are below the poverty line. So how many people that are looking for a one-day meal, just one-day meal, will not be thinking of flying out of the country to go and seek healthcare? No, let's be realistic.
Sir, so I was actually running out of time. Your last thoughts, like, what's your call to the FCT administration?
Well, my call to FCT administration is simple. They've been in the discussion table. Yes, there is no sitting minister, but the permanent secretary, who happens to be the head of government at the moment, was there in the meeting. We met with the minister twice. He knows what is happening. The director of human resources was also there. They know what is happening. They should do the needful. If they really think that the health of the FCT resident matters to them, these are not high-falutin issues that they cannot be addressed. Because what baffles me now, 11 days after an ultimatum has been issued, none of them has bothered to even call, which means, of course, they don't care about the people they are presiding over. It is very obvious. Or maybe they are waiting for 2 or 3 days to the expiration. Oh, don't worry, people should not go on strike, we'll resolve the issue. We've gone past the issue of promises, because they've not shown any commitment to say that they can always keep to promises.
Could it be possible that the rationale behind them not being able to have contacted you is because there's no sitting minister in that ministry?
Well, I don't think everything is in FCTA now is shut down. If there's no sitting minister, we have the permanent secretary. And at the moment, the president is the head of every organization. So if, no longer the president is there, of course, a decision can be taken.
All right, thank you very much, sir, for coming to the studio.
Thank you very
and
much.
to shed more light on issues happening in with medical doctors and the FCTA. Over to you, Meg.
Okay, it's been Dr. Roland Aigbovo, President, Association of Resident Doctors, FCTA. We hope that your 3 major issues are addressed, and the next time that we'll have you in the studio, you will be coming to commend the FCTA administration and all.
Yeah, no problem. If they do the needful.
They should. Thank you very much, sir, for coming on the show. We'll go on a short break, and press review is next on our lineup. Don't go away.